So it seems like Senate Democrats have finally come to terms with the reality that Medicare for All is in fact a litmus test. And if they don't co-sponsor Bernie Sanders' Medicare for All bill, then it's very likely that they will be primaried. So now that they know what's at stake, Democrats are reacting, and some of them aren't too keen on the idea of Medicare for All being a litmus test. So Senate Democrat Brian Schatz spoke out against the idea of Medicare for All being a litmus test on the Arena Talks podcast, saying, quote, "I'll just make one broader point about healthcare and politics. It's only in healthcare where, if you are not for single payer, you are immediately a sellout. It is only in healthcare where everything becomes a litmus test about your progressive purity," Schatz said. "And I think that's nuts," he added. "I think Medicaid should compete with these private sector options. I don't think it should necessarily replace the private insurance market," Schatz said. "I'm open to a proper legislative process where we take 3, 4, 5 good progressive ideas, maybe even 3, 4, 5 moderate or conservative ideas, and see what shakes out," Schatz said. Why don't you tell us how you really feel, Brian? So, since he is not co-sponsoring Bernie Sanders' Medicare for All bill and doesn't support the idea of single payer, he stated his intention to sponsor a bill that would establish a public option. So, first of all, I'm glad that he at least acknowledges that Medicare for All is, in fact, a litmus test, because in accepting that fact, it does legitimize progressives and empowers us. But he is implying here that it's arbitrary for progressives to accuse Democrats who are against single payer as being sellouts, because not everyone who disagrees with progressives are just automatically sellouts. I mean, there's nuance. You can have a difference of opinion. That's basically what he's contending. Now, theoretically speaking, he's not wrong there, but the problem is that on an issue like Medicare for All, the overwhelming majority of the Democratic Party's voters want Medicare for All. So in simply saying, well, I have a policy disagreement, well, too bad. You were voted in office to represent the American people, specifically the Democratic Party's constituents. So in not supporting Medicare for All and not co-sponsoring Bernie Sanders' bill, in remaining defiant to what Democratic Party voters want, I think that you're doing a disservice to them, and I think that you are not representing them well. And second of all, this argument about us arbitrarily labeling everyone who disagrees with us as sellouts, it would have a little bit more weight to it if Brian Schatz wasn't a sellout himself. He's literally a sellout to the health insurance industry. Throughout the course of his career, he took more than $100,000 from health industry PACs, and Blue Cross Blue Shield, surprise, surprise, is literally one of his top contributors. So for whatever reason, these health insurance companies that stand to make a lot of money off of sick Americans, they really like Brian Schatz. I wonder why that's the case. Oh, that's right. It's because he's fighting against single payer. Now, again, I find it so hilarious that his implication is that progressives shouldn't pin any and all people that disagree with them as sellouts when he literally sold out. I'm not calling you a sellout because you disagree with me, Brian. I'm calling you a sellout because that's a fact. When I look at your campaign contributions, when we look at your FEC filings, we see you took money from the health insurance industry. You know what that makes you? A motherfucking sellout. If you don't like that fact, then stop taking money from them. Now, he supports a public option, and theoretically speaking, I do too, because yeah, that's a step in the right direction. But the problem is that if you start negotiations with Republicans at a public option, do you know where you'll end up? With Obamacare. And that's exactly what happened. He talked about how, we need to take a couple of progressive ideas, mix those in with some ideas from moderates and even conservatives and see what we get. But that's exactly what we did with the Affordable Care Act and negotiations for the Affordable Care Act. We got a Republican-based plan that was thought up by a conservative think tank, the Heritage Foundation. So I don't understand how he could still say this with a straight face. And in championing the idea of a public option, this is just his way of keeping his donors in business. And unless you take the profit motive out of healthcare, then you will continue to have a system where money is the priority, not the delivery of healthcare. And that is wrong. So for me, the default is Medicare for All. And if someone has money and they want to buy insurance on the private market, then they could do that. Now, I'm okay with that in Bernie Sanders' bill and John Conyers' bill, but personally, I would just outright abolish private insurance companies because I don't want a two-tiered healthcare system where the rich and the poor get different levels of care. I want a system where everyone has the same level of healthcare because the lives of Americans shouldn't be valued based on how much money they have. It should be valued because they're American citizens and we take care of our own. So Brian Schatz here, I'm glad that he decided to speak out because, credit where credit is due. A lot of Senate Democrats will usually just be passive aggressive, or they will, they'll make an off the record statement, but here he is, he's saying that he doesn't support Medicare for all and he thinks the idea of a litmus test is nuts. No, the idea of not supporting Medicare for all is nuts at this point because currently we have thousands of people dying every single year due to a lack of health insurance. And if you think it's nuts for us to ask for something that all other modern industrialized countries have, then you're nuts. It's not us, it's you. Sorry, Brian.
Support this podcast by becoming a patron at patreon.com/Humanist Report.